Measles cases have been confirmed in 38 states so far this year. The CDC is reporting 1,288 measles infections this year, the most since 1992. Those statistics stand out because 25 years ago, measles was declared eliminated here. The vast majority of these cases are in Texas, where 2 children died this year from the virus. A third confirmed measles death was recorded in New Mexico. All of those patients were unvaccinated. I want to bring in CBS Chief Medical Correspondent, Dr. Jon LaPook. Dr. LaPook, how bad is it? I want you to help our audience understand that they see in their phone all sorts of headlines. It may sound like this is the worst thing ever. How bad is it, and how did we get here?
Well, just look at it right now. You look at those numbers, and they are troubling because we haven't seen those numbers in many, many years, because we do have a very effective vaccine, which is like 97% effective at preventing measles if you get both doses. But I think a little bit of history is important here. You know, I see that the chart there. 1963, the very effective measles vaccine came out, and you just plummeted from 3 to 4 million cases a year down to so much lower. I actually did a deep dive and went back to an article from 2007 in the Journal of the American Medical Association. I think it's going to help put this in perspective and why we're so concerned. Because it's not just a matter of measles, okay? But a lot of the other childhood diseases, people have forgotten about them because they haven't seen them. And if you just look at the 9 of the top childhood infections that are now vaccine preventable, okay? I'm going to just reel them off. Diphtheria, measles, mumps, pertussis, that's whooping cough. Acute polio, paralytic polio, rubella, that's German measles, smallpox, tetanus. If you go back to before there were vaccines, they accounted for more than 1 million cases a year of these illnesses and more than 10,000 deaths. Now, as of 2004, which is, where this article went up to, the number of deaths, 31. From more than 10,000 down to 31. So people are sort of blasé about it because they figure they've never seen it. I spoke to a pediatrician who said, here's an odd thing. When you have a parent who's not immunizing their child, you talk to their parents, so the grandparents of the child, they all vaccinated their kids. So the parents of the kids who are not getting vaccinated usually are vaccinated themselves, so they don't have the fear of it. They've never seen it. So what's there to be afraid of, sort of? And that's one of the issues that we have.
So quickly, Dr. Jon LaPook, in this context, we need to sharpen our focus on the vaccination conversation.
Yeah, absolutely. And to be clear, there have been vaccine hesitancy, or people anti-vaccine, since there were vaccines. Benjamin Franklin went to his grave regretting the fact that he did not give an early form of smallpox vaccine to his 3-year-old son, Frankie, yes, Frankie Franklin, who then died of smallpox. And it's just, over the years, there's been this. It ramped up, of course, in 1998 when there was an article that falsely linked MMR vaccine to autism. That's been debunked with many, many studies. But now once, you have this out there in the zeitgeist and on the internet, in the internet, and with all this mis and disinformation, you're really running into a real challenge now. We have to try to not just from the top down, from so-called top down, from public health officials who are weighing in, but also from the ground up, from the trusted people in communities, religious figures, community leaders, physicians, clinicians. I think it's got to be a all hands on deck effort.
Dr. Jon LaPook, always a pleasure. Thank you so much, sir.